Hey everybody, welcome to my channel. Let's talk mental health with Dr. Lawal, my humble self. And chances are you or someone that you know has been impacted by mental health or mental illness. And the purpose of creating this channel is to provide an opportunity or a platform for us to come together as individuals, as a group, as a community, to talk about issues of mental health, to support each other, to serve as a resource for one another, and also to serve as a voice and to advocate for issues that pertain to us, that affect us, that we hold dearly in our heart and are feeling passionate about around mental illness. And the goal is to, improve mental illness or the services or the outcomes surrounding mental illness. And mental illness does not discriminate. It affects everybody. And it affects every age, it affects every race. So, like I said earlier, chances are you or someone that you know has been impacted by it. And I know around the world right now there's a lot of mental health discussions going on. There's epidemics around drug overdose and drug use, and there's always a root cause to that. And the purpose of this is to carry on that momentum that we have right now. It's a good thing that we're talking about mental health, or the world is talking more freely about mental health, but we need to continue and take advantage of this momentum and have a voice and have one another to come to and support each other and to get through things that are that affects our quality of life and around mental health. I do know, historically in healthcare, we've done a lot of great things around physical health. We've done a lot of great things in disease prevention, but not so much with mental illness and mental health. And I think the time is now. The time is now for us to come together. The time is now for us to speak. And here we are, and I am going to be one of those voices, and I count on you as well to be one of the voices that will come together and speak on issues that are dear to us. What I would like to see from my followers, from my subscribers, is to engagement. Stay engaged. If there's a particular issue around mental illness or mental health that you want to talk about, or if you have questions, I want you to feel free to send me those questions, ask questions, suggestions. If you have a topic that you'd like me to research and come back with resources that I can share or knowledge that I can share with everybody, I want you to do that. Reach out to me, and then we can, like I said, get the conversation going. I know for one thing that I really hold dear to my heart and I'm feeling passionate about, having worked in healthcare for a while now, is the work-related stress that comes around for healthcare workers. And I don't think it's been talked enough. We've done a lot of work with advocating for our patients, but I don't think we do enough advocating for ourselves and our mental health. And I think that should be as important as anything else that we do. So I know for us as a registered nurse, as a healthcare professional, I have seen it firsthand. I've experienced the stress myself, and I've seen it firsthand how the work environment can be for healthcare professionals. And I know, and I've seen people that, it's impacted their quality of life, it's impacted their work life, and it's impacted their private life as well. And how can we make things better? How can we do things differently? We can't do it by just looking the other way. We've got to have those tough conversations. We've got to speak up, and this is what this is about. And this is the time. The time is now. There's never a right time. You make it a right time, and I think the time is now for us to start talking. So this is why we're here now, and let's keep it going. Before I round up for today, I would just want to give a shout out, as most of you or everyone will know, today is the national. It's actually International Workers Memorial Day. It's a day that is dedicated to acknowledging and paying our respects to those that have died on the job, and also for those that have been injured, to advocate for better and safer workplaces for those that have been injured on the job or have had diseases acquired on the job. And I know, when people usually talk about workplace safety or workplace injury or workplace death, we talk about accidents, and we talk about like cancer that are acquired or exposures to work-related environments that makes us sick. But there's not enough talk about, like I said earlier, the stress that results in, be it anxiety, be it depression related to our work. So all of that is part of advocating for work and a safe place for everyone, for workers around the world, and especially those in healthcare. And so I just pay my respect, and my respect goes out to those that have lost their lives, to their families, and it's unfortunate. But for us that are still alive today, this is our opportunity to advocate for a safer workplace and for resources that we think are important to us to make us to keep the workplace safer, and both physically and mentally. As you know, when we are physically healthy and mentally healthy, it improves our overall quality of life. We're more engaged. It carries on to down to our families, our children. They're happier. They're more productive. And so this is basically speaking up for that and paying my respect and saying, let's go forward, let's come together, let's talk mental health, and let's go forward as a team, as a group, as a community, and make a difference in our lives and in the lives of those around us. So thank you for tuning in. Thank you for watching. Please don't forget to subscribe to my channel, and also like and share, and talk to your friends, talk to your families, and come together and make a difference in mental health and illness and the quality of care and resources that we have dedicated to these issues. Thank you, and I'll see you in my next episode.